Have you ever wondered what's going on inside the body as a human? Do you know that your body has special organs that controls your period, hormones, and ability to have babies? Hello friends, I am Nurse Annie and welcome to my channel, Nurse Annie Med Talks. My name is Nurse Annie and I'm a nurse who loves to teach about women's health and also in a simplified and friendly way. On this channel, we talk about women's health, gynecological issues, and how to take care of your body as a human. Before we start, please subscribe to my channel, like this video, turn on the notification bell so you don't miss any video. I upload health education videos every week. Now let's learn together. The female reproductive system is a group of body parts inside of a human that work together. These parts help you to make eggs, control your hormones, have monthly periods, support pregnancy and childbirth. But the reproductive system is not just about making babies. There is more to that. It also affects your mood, your energy, your skin, your body changes. That is why it is important as a human to understand it. The female reproductive system has two main parts: the external part, which is outside the body, and the internal part, which is inside the body. Let's start with the external part. Let's start with the external part. The external part of the female reproductive system is called the vulva. Many people often mistake the vulva for the vagina, but that is not correct. The vulva includes the labia majora, which is the outer lip, and the labia minora, which is the inner lip. We also have the clitoris there, which is a very sensitive part. We also have the vaginal opening. The vulva protects the inner parts of the female reproductive system. Every human vulva looks different and it's absolutely normal. If you ever notice pain, swelling, itching, unusual discharge, it is important that you see a healthcare worker. Internal parts of the female reproductive system. Now let's talk about it. We have so many parts such as 1. The ovary. The human ovary, there are 2 in number. And what is the function of this ovary? The ovary stores egg and releases the egg every month. Many hormones such as estrogen and progesterone enables all this to happen. The hormones control your period and also your body changes. We also have another part known as the fallopian tube. The fallopian tube is a small tube that carries egg from the ovary to the uterus. This happens when it has been produced. If pregnancy occurs, it usually happens at the fallopian tube, which is a point of fertilization. The uterus, which is another part, it's also known as the womb, which we commonly know. The uterus, this is where the baby grows and baby implants. After it has been fertilized in the fallopian tube, it moves to the uterus to be implanted there. Every month, the uterus prepares a soft lining that also helps for pregnancy. It nurtures pregnancy. In a situation where pregnancy does not occur, it then sheds. That's what we call uterine bleeding or uterine shedding. You can also call it uterine crying. The menstrual flow or period. Another part that we have is the cervix. The cervix is the lower part of the uterus. It connects the uterus to the vagina, so it serves as an intermittent to the vagina and the uterus. Doctors check the cervix often during pap smear tests. We also have the vagina. The vagina is a tube that connects the cervix and the uterus, and also it connects the cervix to the outside body. This is where menstrual flow passes through. Also, babies pass through. It also plays roles in sexual health during sexual intercourse, whereby the spermatozoa passes through there into the female system. The menstrual cycle is another important part in the female reproductive system. Now let's talk about the menstrual cycle. The menstrual cycle, this is a monthly changes that happen in every human's body and is divided into so many phases. 1, we have the period phase. This period phase now is like the extent and the peak of it. This is when bleeding occurs, and approximately it occurs 3 to 7 days. And in different women, it's different. So don't be anxious that your own is not the same with this person. Is absolutely different with different women. So we have the follicular phase. Before period occur, there's what we know as follicular phase. This follicular phase is going to help to produce follicles. We call them Graafian follicles, and these follicles enables the production of new egg, and this is when the body prepares the new egg production. Hormones controls the production of this. Hormones rise and uterus begins to grow, it begins to thicken. Then we have another phase known as the ovulation phase. During ovulation, one egg is released from the ovary and it goes to where? The fallopian tube. When it goes there, if a human becomes pregnant, then that means the egg in the fallopian tube has been fertilized by the spermatozoa. We also have another phase known as the luteal phase. After ovulation, the body awaits pregnancy. If pregnancy does not happen, then your hormones drop. And when the hormones drop, the uterus that has been thickened in preparation of fertilization and implantation, it then sheds, which is known as what? The cycle. And this repeats itself every month. Hormones are very important in human body. And how does this hormone affect a woman? We have two important hormones as mentioned earlier, which are what? The estrogen and the progesterone. They affect your mood, they affect energy, they also affect breast changes, they affect period. That is why some women feel happy, tired, or emotional during different times. It's not about mood swing, it's about their hormones which controls them. How do the body changes with age? As women grow older, period change, hormone change, fertility reduce because of the hormones and the physiology of the human body. Before menopause, women go through perimenopause, which is before 45 years old, depending on each individual. While menopause, approximately, it starts from 45 years old to above. These changes are normal. With this knowledge, it's very important that you know your reproductive organ. Also, notice any early changes, speak to your doctor, and take better care of yourself. Knowledge helps you protect your body. Conclusion: thank you so much for watching Nurse Anime Talks. Click on the subscribe button. Also, remember that your body is very important. Your body is something you should understand. Subscribe, share, and like. Thank you.